Well, swine flu is entirely avoidable. Vaccination will mean that you won't get swine flu. It's really important that healthcare workers, whether they work in primary care and GP surgeries or in hospitals, in critical care, have this vaccination.
The swine flu virus is a new one, which means that really all of us are susceptible to acquiring the infection.
Very important that staff get vaccinated, really for three reasons. One is for their own health, secondly for their children and their family, and thirdly, of course, for patients.
If too many NHS staff go off sick with swine flu this winter, the NHS will struggle very severely.
If we allowed this to become a sort of rampant flu-like outbreak, it would have a significant impact on us. Within a couple of weeks, really, we will be struggling to provide a frontline emergency service for the general public. That could really undermine the NHS.
We have a huge workforce here in the ambulance service, and if we do get a lot of staff members incapacitated, then there could be huge problems manning ambulances, manning response cars, working in control. The whole organisation could be severely at risk.
If we have whole departments become sick at a similar time, we may end up not being able to provide a service to patients.
There are relatively few intensive care consultants in many hospitals across the United Kingdom. If only one or two from each hospital were sick, it would be very difficult to maintain the level of service.
Swine flu can kill. It can be a very severe illness that takes weeks to get better. They can be in intensive care with multiple complications, and it can be touch and go, life and death situation for weeks.
It's very dangerous. Some of the patients that we see are presented with absolutely no symptoms at all. Others do present with symptoms. They come into critical care and they deteriorate very, very quickly.
It affects a younger patient group, more in the age range of 20s to 40s, and makes them severely ill. And we have had a recent death in intensive care here of a patient who was much younger.
If it's your loved one that becomes sick, then clearly it's a disaster for you and your family.
And it's really important that all of our staff try and attend work and protect themselves and keep themselves healthy and have the vaccine.
It's important that if there is a safe vaccine that can keep us working, we should have that immunisation.
I've had it because I want to protect all my patients and my family.
I've had the swine flu vaccination for personal protection for myself and for my family, but equally to protect the women and the babies that are in my care.
I'm a doctor in intensive care. I've had the swine flu vaccine. It's important to my patients who are very vulnerable, as well as my own family at home.
I've had the H1N vaccine today to protect my children at home, but also so as I provide a service to critically ill patients in intensive care.
I think vaccines have been around, and flu vaccine have been around for a very long time, and really this is something that's been produced in the same way that it's produced every year.
It's a safe vaccination and it will protect both patients and healthcare workers.
I think vaccination is the right thing to do. I have a duty to turn up for work whenever possible, and particularly at times when there are major health problems across the whole United Kingdom.
Flu. Protect yourself and others.